Over the last 15 years, the blood and marrow transplant program at the Queen Elizabeth Hospital in Birmingham has grown substantially in size and at the same time consolidated a reputation for international excellence. It's very fortunate to be located on one of the best biomedical campuses in the UK, serving one of the largest catchment regions in Europe. The excellence of the facilities and the relentless focus on delivering high-quality patient outcomes mean that our overall survival data are comparable to those of the best units in Europe. We recognized about 10 years ago that at a time when almost all patients have a suitable donor, we still are faced with the unacceptable situation that large numbers of patients relapse of their original disease post-allograft.
Allogeneic stem cell transplantation remains a very effective treatment for patients, but relapse remains one of the leading causes of death following transplant. So in our unit, we are trying to develop a vaccine strategy to reduce the risk of relapse by boosting the immune response against a minor histocompatibility antigen called HA1 in donors who are donating stem cells to transplant patients. We are currently developing this vaccine using healthy volunteers in a first-in-man phase 1 study to demonstrate efficacy and safety. If we can demonstrate this, then we hope to take this forward into phase 2 studies so that we can administer it to donors who are going to donate stem cells to allogeneic stem cell transplantation patients.
At the same time, there has been an explosion in the number of new and potentially highly active drug and cellular therapies available for transplant patients. And so our mission really has been to connect patients with these innovative therapies through clinical trials.
Hello, hematology trials, Michelle?
Birmingham really has pioneered trials delivery, and the way in which it's done that is by setting up a trials acceleration programme. So the idea of this programme was to develop and writing protocols, recruiting patients and publishing those results quickly and with the long-term aim of improving outcome of patients much sooner. Having launched that in leukaemia and lymphoma, we're looking to do that in a transplant setting now, so we'll have a transplant trials acceleration programme, and the results to date have been that we've managed to work on 18 trials in the space of about 4 years. We've recruited over 700 patients. And if we can replicate that in a transplant setting within the UK or wider, that would be an amazing achievement to come out of Birmingham, really.
The 3 main clinical studies that I'm involved in include the Viola study that looks at using 2 chemotherapy drugs, azacitidine and lenalidomide, for patients who have got relapsed AML or MDS post-transplant and otherwise would only have palliative care as a treatment option. The ROMAZA study, which again uses 2 chemotherapy drugs called romidepsin and azacitidine to induce partial or complete remissions in patients with AML and MDS. And then finally the Figaro study. Figaro is one of the first prospective randomised controlled trials in transplant. We are looking at conventional chemotherapy regimes and comparing them to a Flamzabu more intense regime to try and enhance the curative role of a transplant. And we are offering this study that randomises between a new regime that offers higher dose therapy compared to conventional chemotherapy, and it's going really well. We've recruited over 140 patients. So the results of this are going to be really quite important in dictating how transplants are done in the future.
I was diagnosed about 4 months ago with acute myeloid leukemia. I've had 3 doses of chemotherapy and then I was admitted to the QE this week to start the conditioning chemotherapy before a transplant next Tuesday. I feel very positive about it. Yeah, I feel well looked after.
Working the trials is extremely fulfilling, especially the early phase trials, because we give patients the opportunities that they wouldn't have had previously. We take patients right from the start, so we give them the information. We are there when they sign the consent form, so we make sure that they've got all the information they need, understand exactly what is involved with the trial, and we follow them through the whole process.
I was first diagnosed in February 2013. The result of that, I was given a bone marrow transplant at Birmingham, which kept the disease at bay for about 21 months or so. Unfortunately, earlier this year I was told it had come back. I think I've been rather fortunate in that they offered me the chance of this drugs trial. This viola trial could turn out to be as good as a transplant. So I can only hope it's successful.
Previous to the trials, he wouldn't have had any further treatment. He would have unfortunately been given supportive care, which is blood transfusions and platelet transfusions, and kept alive for as long as possible. He's actually gone into a clinical trial, which has been very successful for him. He's tolerated the treatment well, and he's actually gone into a complete remission.
It really never has been a more exciting time to work in the field of stem cell transplantation. Critically, a time when we've got such great opportunities to improve patient outcomes. And what we have in Birmingham is almost every ingredient that's required to drive forward innovative, practice-changing protocols, with a large catchment region, a fantastic hospital, an extremely collaborative university, and a number of wonderful links with other UK and international centres. And to have this nested in a city that is growing in confidence and excitement, we've got a real opportunity to be at the forefront of driving forward advances in stem cell transplantation.